So here we see the rotator cuff, and here is an image from MRI with the field of view. This individual has some thickening of the subacromial subdeltoid bursa, which is hypoechoic. These two bright lines on either side are the bursal walls and peribursal fat. Note the hypoechoic deltoid muscle, and here's the greater tuberosity. So when I turn short axis, I begin over the humeral head. Basically, what I like to see is the round surface of the humeral head, the hyaline cartilage, and a uniform thickness of the tendon. I like to see the biceps tendon as well in the rotator interval. So I start over the humeral head. I don't start over the tuberosities. Once I have this in view, then I move the transducer distally. As we leave the articular surface and get to the greater tuberosity surface, we now see the superior and middle facets as the bicipital groove is starting to form. Note that the tendon is starting to thin now. As you can see, it's attaching onto the greater tuberosity. As we move even further distally for the rotator cuff, it thins out even more. We now appreciate the superior and middle facets. So the supraspinatus is this structure that's nearly gone. This is all infraspinatus now, coming in at a different angle. So once again, you're looking at the infraspinatus in addition to the supraspinatus with this maneuver. Re-emphasizing these bone facets, there is some variability in the tendon attachments, but this is what is usually discussed in literature as the most common appearance, where opposite the superior facet, it's only the supraspinatus, but some of the supraspinatus comes over the middle facet as shown here. So in younger people, you'll have a tear here. In older people, it tends to occur near the apex or even over here. Note how the infraspinatus comes over the top, which is right like this. So these bone facets allow us to distinguish the supra from infraspinatus. So here's a video clip. Here the bursa is a little bit thick. That's not normal, that's abnormal. But I'm showing here in the video in a second, first of all, the humeral head, rotator interval, and we're going to leave the humeral head and we're going to get to the facets. So as we go distally, there we leave the hyaline cartilage, there's superior and middle facet. So you appreciate us going from the articular surface to the greater tuberosity surfaces.